Good afternoon, all. Thank you so much for joining us today. My name is Grace Atherton. I'm the Communications Director for Wisconsin Cheesemakers Association, or WCMA, and we're so thrilled to have you with us this afternoon for a very informative webinar on H5N1 and employee safety for dairy processors. I just want to give a couple of housekeeping notes before we get started here. Please make sure your mics are muted and your video is off to avoid any interruptions during our webinar. We will have a Q&A session with our presenters at the end of the webinar. So if at that time you have a question you'd like to ask either of our presenters, please feel free to unmute at that time and ask, or you can always submit those questions in the chat as well throughout the session, and we'll make sure to get through as many of them as possible in our Q&A section. I also want to note that we will send a follow-up email later this week after this webinar concludes to all of those who registered for the webinar with a link to a recording of today's session, helpful resources and contacts. All the links and information you'll get today during our webinar will also go out in that follow-up email. So be sure to watch for that email from me before the end of this week. First, before we get into things, let's go over our agenda briefly, just so we have a roadmap of where we're going today. First, Rebekah Sweeney from WCMA will give us a situation report on H5N1, where we're currently at. I know there's a lot of news breaking on this every day, so this will be a helpful summary of where we're at to this point. Then we'll turn to Dr. Carrie Reed of the Centers for Disease Control and Prevention to talk more about how H5N1 spreads, followed by Dr. John Gibbins, also of the CDC and the National Institute for Occupational Safety and Health, who will talk some more about strategies you can use to safeguard your dairy processing employees from H5N1. Then we'll turn back to Rebekah for some H5N1 resources that are currently out there and available to dairy processors, many of them free and available to you right now. And we'll go into our Q&A session, as I mentioned earlier. So again, if you have questions throughout the session, please feel free to drop them in the chat, and we will get to as many of those as possible at the end of our webinar. So to start us off, I'm going to turn things over to my fearless colleague, Rebekah Sweeney, WCMA's Senior Director of Programs and Policy. Rebekah?
Thanks so much, Grace, and thanks go to all of you for joining us today. We appreciate your attention to this issue and the way that you care for your employees. WCMA is a national organization supporting dairy processors and their supplier partners coast to coast. We know that today we also have non-members joining us. We want to make sure that everyone in the dairy processing industry has access to information on H5N1 and best practices for keeping not only their customers, but their employees safe. We know that your employees are your most valuable resource. And we know that the threat of highly pathogenic avian influenza, or bird flu, as some call it, has many of you thinking about what steps you can take to maintain the safest possible work environments for your teams. And I'm really pleased and proud today that we can bring you answers straight from the Centers for Disease Control and Prevention. But first, I'd like to make sure that we're all starting with the same very basic knowledge about this threat. Bird flu is not a new concern. In fact, it was first described in Italy in 1878 as a fowl plague. Now, I don't know if they knew at the time that was a pun, and it's not funny, but I did find it interesting. And this virus seems to have a lot of different names. We've gone through iterations of HPAI and H5N1, and so it's important that we familiarize ourselves with the history on this. As viruses do, bird flu has mutated and evolved over the years and has presented in a variety of strains. This particular strain, known as H5N1, first emerged in wild birds and poultry flocks in Europe in the fall of 2020, but it is now spread across the 6 continents. You're looking right now at a heat map of sorts, showing where we've seen the most significant animal impact, but truly it's everywhere. Notice the dark red across much of North America. That reflects the infection and morbidity rates for birds. But I want to note that since 2022, the U.S. Department of Agriculture has also reported an H5N1 virus detections in more than 200 mammals. That includes bears, raccoons, cats, mink, bobcats, lots of things that we find here in the upper Midwest, but really all across the United States. And of course, why we're here today, in March of this year, H5N1 was first detected in dairy cows in Texas. And since then, 172 dairy cow herds in 13 US states have confirmed cases. This has many in our industry concerned not only for animals, but also for the humans that care for them, and also for those that process their milk, which has proven to carry the virus. Farm workers are getting H5N1, as you've seen in the news, and recent studies are also showing that mammal-to-mammal transmission is possible. With that said, for now, H5N1 remains primarily a virus impacting animals, and we know that we can take action to help keep it that way for longer. The US Food and Drug Administration maintains, following many studies, that pasteurization is effective in activating the virus. And sanitation and the use of personal protective equipment can help safeguard those in close proximity to animals and those handling animal milk. For much more on how this virus spreads and how you can keep your employees safer at work, we're honored to bring you information directly from the Centers for Disease Control and Prevention. Our first guest presenter today is Dr. Carrie Reed, who has served in leadership positions with CDC for more than 17 years. She currently works as chief of the Prevention and Epidemiology branch of the Influenza Division and Epidemiology Task Force lead for H5N1 response. All of her career, she's worked in the field of influenza response, so she knows what she's talking about, and we're grateful to have her time. Dr. Reed, thank you so much for your important work and for the generosity of your insight on how this virus spreads.
Great, thanks for the invitation. I'm happy to be here today and share some information about this. Let me get my slides here. Great. So as mentioned, I've been at CDC for a long time working on influenza, and just to start here talking about what CDC's priorities are throughout this response and kind of ongoing spread of avian influenza for many years now. Currently, we are spending a lot of time supporting and engaging our public health and agricultural partners throughout the US, particularly in state and local jurisdictions, as they deal directly with workers who are exposed to infected animals. Our primary focus is protecting human health and safety. So helping states stand up monitoring of workers that have been exposed to infected animals, making sure that they have the information and the resources that they need to help prevent infections among people in their jurisdictions. We also do additional studies and investigations to try and understand the risk of infection and spread from animals to people with these viruses. And then our lab colleagues here at CDC also spend a lot of time evaluating genetic sequences from H5N1 viruses in people, human infections, as well as animal infections, to monitor for any changes that might indicate the virus is adapting, maybe more readily spread to people, among people. And so that's something that we're also very focused on at CDC. And so to start, I want to give a little bit of an overview historically of these highly pathogenic avian influenza H5N1 viruses. There are a lot of different kinds of flu viruses that have different letters and number combinations. Some of those naturally infect humans. Some of them naturally infect wild birds. And so this particular strain of flu, H5N1, was first detected in a poultry outbreak in Scotland in 1959. And it was labeled as highly pathogenic avian influenza because it infected the respiratory and gastrointestinal tracts of birds and caused high mortality in infected poultry. Not all avian flu viruses do cause high mortality in poultry when it infects poultry, but some strains of virus, particularly this H5N1 virus, are highly pathogenic in poultry. And so that's how it got the designation highly pathogenic avian influenza. Since that time in the 1950s, these H5N1 viruses have continued to spread, particularly among birds and poultry, and continued to evolve and be classified into a number of different virus genetic clades. The current virus that we're talking about is an H5N1 virus that's further characterized by being in this particular clade 2344B. You may hear that or see that in the news. And these clade 2344B viruses emerged in 2020 in wild birds and were associated with unprecedented wide global spread. So H5N1 viruses have been recognized in a variety of geographic areas, but not at the scale geographically as we've seen since 2020 with this particular clade of H5N1 viruses. Many bird species have been infected all over the world. We've seen poultry outbreaks in places where migratory wild birds have been through and likely transmitted from wild birds into poultry. And again, because it has high mortality in infected poultry, this is often very visible when poultry become infected and swift action taken to control spread within poultry populations to avoid further loss and further damage in poultry flocks. But in addition, there have been many terrestrial and marine mammals that have been infected, often fatal. For those cases that have been recognized where they come in direct contact with wild birds, dead wild birds, infected wild birds in the wild. And so those are things that have been recognized and followed for these past 4 years with this particular clade of virus. In North America, it was first detected in wild birds here at the very end of 2021 and have continued to see poultry outbreaks and wild bird detection since 2022 and ongoing. So during that time with this particular virus, since it's been recognized in North America, there have been over 99 million commercial poultry and backyard birds affected in 48 states, over 9,500 wild birds that have been detected across all 50 states or territories. And then just as mentioned, this year, for the first time, detected in livestock, in goats earlier in the year, and then dairy cattle and continuing in dairy cattle. Human infections with this particular H5N1 virus have also been recognized. Human infections with all H5N1 viruses have gone back to the 1990s, late 1990s, but with this particular strain of H5N1, there have been 26, prior to this particular outbreak in dairy cattle, there were 26 sporadic human cases of H5N1 of this clade that were reported from 9 countries. It includes 15 cases of severe or critical illness and 7 deaths, which is why this has been of particular note to public health to be monitoring as these viruses continue to spread across the world in bird populations and poultry populations, because we have found cases of very severe disease in humans throughout the world. There's also been cases of mild illness, including asymptomatic cases that have been recognized during this time as well. So a very wide spectrum of potential presentation in people. But again, with the risk of having severe illness among cases of H5N1, particular concern by public health to make sure we're monitoring the situation and are identifying any cases quickly in people if they occur. Prior to this particular outbreak in dairy cattle, most human cases of H5N1 have had recent exposure to sick or dead poultry, and noteworthy, no human cases of human-to-human transmission have been identified during this recent few years. And so the new twist this year was that dairy cow illness began to be recognized in early 2024, syndromic illness with significant decreases in milk production and milk quality. And then in March, USDA did confirm that H5N1 was detected in cows in Texas and in Kansas. And today, USDA has confirmed H5N1 infection in dairy herds in 171 farms across 13 states. So has continued to spread throughout dairy herds throughout the US in many states. And so on the CDC side, we've been particularly interested, as I mentioned earlier, in working with our state and local partners on monitoring for any human illness associated with exposure to infected animals. And as of last week, we have now confirmed 10 total cases associated with poultry exposure. One of those was back in April 2022 when these viruses were first spreading in wild birds in North America and causing poultry outbreaks. And then 9 cases recently in poultry workers performing depopulation activities in Colorado has been recently reported out by CDC over the past few weeks. All of these cases were clinically mild, no one was hospitalized, and everyone has recovered from those poultry exposures. We've also had 4 human cases associated with dairy cattle exposure since this was recognized in dairy cows in March. We have had workers now in 3 states on 4 different farms that have been infected and recognized. Again, all of these cases, thankfully, were clinically mild, not hospitalized. They've all recovered, predominantly presented with conjunctivitis in many of these cases, but also some mild respiratory symptoms in several of these cases as well. And so one of the big activities that we work on, again, with our state and local health departments is surveillance, human monitoring, testing, making sure that we can identify quickly any cases of animal to human transmission that might be occurring. So our top priority is to monitor people that have been exposed to infected or sick animals for at least 10 days after their exposure ends, test anyone that develops signs and symptoms of possible infection, with a fairly broad list of signs and symptoms. So these are conjunctivitis, cough, sore throat, fever, things that people might get from a lot of potential causes. But we want to be vigilant, making sure that if people are developing any symptoms, that they have access to testing and confirmation if they are infected. And then when any human cases are identified or confirmed through testing, that there's follow-up of those cases, of their contacts, assessing for any possible human-to-human transmission, providing information, providing antiviral medications to treat cases and to prevent transmission in their contacts. And as I mentioned, since this was first recognized in dairy cows in March, there have now been at least 4,100 people that have been monitored by state or local health departments. A mix of those with exposure to dairy cows, about 1,700 people that have had exposures to dairy cows, and 2,400 people that have had exposure to poultry and wild birds and other animals, and testing. So again, if people develop symptoms, making sure they have access to testing to be able to identify any H5N1 infections. So 69 symptomatic people with exposure to dairy cows and at least 140 with exposure to other birds and other animals. We also are doing a lot of surveillance more broadly through flu surveillance channels nationwide. Primarily the risk is focused in those with direct contact with infected animals, but we also know that virus is detected in raw milk, which is exposures that may not be as easy to identify, exposures to monitor people that are exposed. We also want to be able to make sure we're detecting any changes that might lead to human-human transmission. And so we want to have widespread, broad, and deep influenza surveillance nationwide. And as a part of that surveillance, we have testing at our public health laboratories that could detect H5N1 in any specimens that are submitted to the public health laboratories for flu testing. So anybody that ends up getting specimens submitted to public health laboratories through routine flu surveillance would be tested using a protocol that would have detected H5N1 if it were present. And since February, we've had over 36,000 specimens that have been tested in those public health laboratories that would have detected a novel influenza virus, including H5N1. And no positives have been detected through that system. So far, those human cases have only been identified in workers that have been actively exposed to infected animals. And there's no other indicators in any of our flu surveillance systems of any unusual influenza activity for the summer, and no H5N1 detected in any of these surveillance systems that are testing specimens in our public health laboratories. One of the other things that we, excuse me for a second, my light went out in my office, are working on at CDC is to conduct more in-depth epidemiologic investigations to really understand better how is this spreading, how is it spreading between animals, how is it spreading to people, what are the risk factors that might influence transmission from animals to people, or is there any evidence that this is spreading between people from human to human? And so we, kind of across the spectrum, are working very closely with health and agricultural partners at local, state, federal levels to try and understand all of the various investigations that are going on to understand these different routes of transmission that might be happening, and how that influences the risk of exposure to people, the potential routes of infection to people, how widespread potential exposures are in the population and what we can be looking out for in terms of risk to people. And so some of the important public health questions that we're focused on is there evidence of infection in exposed populations? What's the spectrum of illness that we see? What's the rate of asymptomatic infection? Are there cases that aren't being recognized because they aren't even presenting with any symptoms? What types of exposure do people have on farms and dairies where they're in contact with infected animals? Are some of those exposures more likely to lead to human infection? Are there behaviors associated with being at an increased risk of infection or at a reduced risk of infection from use of certain types of PPE, for example? And so we've been working with a variety of states and a variety of partners to do more in-depth systematic studies to collect blood specimens that we could do antibody testing on to look for any infections that might not have been recognized, to assess whether there was a past illness or if these were potential asymptomatic infections, and doing a survey of workers to try and better understand what their exposures were as they come in contact with affected animals, so that we can try and piece together more of the story about how this virus is spreading and what the risk is to people. And does that vary by the type of animal that they're exposed to or the type of work that they do on these farms? And additionally, with the detection of H5N1 in dairy cows, and particularly the detection of virus at relatively high concentrations in raw milk, we've had additional emphasis on CDC's longstanding recommendations to avoid drinking or consuming raw milk. Pasteurization, as mentioned, over numerous studies by FDA, has been shown that it does in fact kill H5N1 viruses, and that pasteurized milk is safe to drink. But that people should not be drinking raw milk or consuming products made from raw milk for a variety of reasons, but particularly in this case, because there is a potential risk of exposure to H5N1 from raw milk from infected cows. And then it has come to our attention that that some people have been talking about the potential of consuming raw milk with live H1N1 virus as a way to develop antibodies. This is something that CDC does not recommend. We recommend against consuming raw milk as a way to develop antibodies to H5N1. As I mentioned earlier, we've seen a number of severe illnesses associated with H5N1 infections globally. Even with this particular strain over the past few years globally. And so although we've only seen mild illnesses so far in human cases in the US, we know that this virus has the potential to cause severe disease in people, and to not take this lightly, but recommend, again, not drinking raw milk from the potential risk of H5N1 in that milk. And so overall, CDC continues to maintain that the risk to the public remains low. This is based on a variety of information. Again, as we look nationwide at surveillance and testing of specimens from people nationwide, we don't see any evidence of H5N1 infection in the general population. So far, the only cases have been from those that have had direct exposure to infected animals. We've been monitoring the genetics of the virus. There have been no changes that would make this virus more likely to infect humans. Right now, it's still very animal-like in its genetic characteristics. And so we don't see any changes that would change our assessment of the overall public health risk from this virus. But as mentioned, there is increased risk with exposure to infected animals or to animal products, or to environments that have been contaminated by infected animals. So anyone with occupational exposure or recreational exposure to animals or animal products is at increased risk because they are potentially coming in direct contact with the virus in a way that most people in the general public are not. And so we continue to recommend that anybody who has been exposed to infected animals should be monitored for symptoms after their first exposure and for at least 10 days after the last exposure to make sure that during exposure and after exposure, if any symptoms are recognized, that they have the opportunity and can access testing for H5N1. And just here to close my part, there's a variety of resources from CDC. I can share some of these in the chat that can provide a way to get more up-to-date situation updates on a weekly basis, learn more about our surveillance systems, how we're monitoring data, how we're monitoring workers that have been exposed, and any more technical information that may be of interest. And I will close there. Thanks, and I'll throw it back to Rebekah.
Thank you so much, Dr. Reed. It was a lot of great information in quick succession. A couple of quick reminders that we are going to be sending a recording of this program out. And yes, you can send me questions directly in the chat. I was getting a lot of them during Dr. Reed's presentation, or you can share them with everyone. We will not identify you when we pose them to either of our CDC guest presenters. But we will save them till the end of our program. With that, we'd like to focus now on those specific strategies that you can employ to keep your dairy processing employees safe from H5N1 or safer from H5N1. Here to share some expertise in that area is Dr. John Gibbins, who is a 19-year member of the CDC leadership team. Dr. Gibbons serves as Senior Veterinary Advisor for the NIOSH Office of Agriculture, Safety, and Health. He was a large animal vet for a long time, even inspected some dairy processing facilities, I understand, in his time serving in the Air Force. Dr. Gibbons, you're among friends today. Thank you so much for joining us and sharing your insights.
Okay, well, thank you for the invitation. And I also grew up showing dairy cattle in 4-H with a high school classmate of mine. So, you know, I haven't been to a county or a state fair this year, but I wonder, you know, what the impact of this has been with that. I know CDC has put out guidance for fairs and exhibitions, and USDA has too. But you know, that's such an important part of farm workers' lives, farm kids' lives, that it's an unfortunate situation. But with that, if you could advance the next slide, please. So before I get into the actual presentation, I'd like to share a little bit about NIOSH, National Institute for Occupational Safety and Health. We are part of CDC. We're the part of CDC that focuses on workplace safety and health across all industries for the United States. And so, you know, our main missions are to do research into occupational safety and health, outreach and education and training. The next generation of occupational health specialists, be it nurses, be it physicians, be it industrial hygienists, folks of that nature. And, you know, we get confused with OSHA a lot, the Occupational Safety and Health Administration, and we have similar missions, but approach it from a little bit different way. We're more recommendations and kind of cutting edge research, and OSHA is more enforcement of standards, which is important also, but we do have different roles. So we're not scary. So to begin with, as we heard, you know, this situation has been ongoing for a couple of years in poultry. And so you know, this jump to dairy cattle really was unexpected. And you know, there's still some debate on when this may have actually started in dairy cattle. You know, the first positive test was back in March, but has this been smoldering for a while? Have there been outbreaks in the recent past? You know, some of those questions are still to be answered. But you know, kind of the current situation is, as Dr. Reed said, we've had 4 workers on dairy farms be diagnosed. To our knowledge, there have been no workers in the dairy processing industry diagnosed with human infection. And, you know, we'd like to keep it that way. And so, you know, 13 states currently infected with outbreaks in cattle. Wisconsin has not been identified. So for the Wisconsin folks on the phone, congratulations. But it's surrounding you. It's in Michigan, it's in Minnesota, and it's in Iowa. So it's good to be vigilant. And so a little bit about, just to touch on the exposures, kind of the on-farm exposures have been, you know, really compare and contrast. The exposures in poultry typically are can often be much higher because workers who are involved with poultry culling and cleanup and disinfection are really exposed to very high levels of virus. This virus, as the name implies, is highly pathogenic or highly infectious and deadly to poultry. And so the situation in cattle, at least that we've seen to date, is a little bit different because cattle by and large don't die from this. They get ill, they have decreased milk production, decreased feed intake, some fever, some GI symptoms, but they by and large recover. And so to date, there have been some virus found in lung and in mammary tissue, but milk is really what we focused on in this outbreak to date. So next slide, please. So the worker protection, this is a challenge because there are different types of worker, from farm workers to processing workers and everyone in between. And so this is just a picture of what we've recommended for workers that are actually on farms and working day to day with farm animals. And it's a fairly challenging recommendation of PPE, I will admit. As I said, I've been on farms, and especially depending on geographic locations, this can be challenging. And so, but we feel it's important, one, to protect the worker as well as to protect the larger public health. As Dr. Reed said, one of the concerns is someone becoming infected with multiple types of influenza virus at the same time, and that can lead to reassortment and potentially a more virulent and more infectious virus. So this is an infographic that we've put out for kind of the farm community to address some of those concerns. And I'll talk a little bit later about some recommendations that also apply to farm workers, but also apply to processing workers. Next slide, please. One of the approaches I think that may help with this is kind of what we call One Health at CDC. Not looking at human health and animal health and environmental health as separate silos, but they're all interconnected, right? And so this outbreak has really demonstrated that you can't just focus on one of those areas because they're all involved in this outbreak. And so I think along with that, looking at the biosecurity on farms as well as the biosecurity and safety and processing plants is important, because the ultimate goal is to limit infection on these farms and limit transmission, and that protects not only the farm workers but the workers in the processing plants and everyone involved throughout the milk production chain. And so that is I think a good goal to limit human exposure, what we call primary prevention in public health. Where that's not possible, I think the next step is really to do what we call hazard assessment. And you do this in your processing plants already for other processes, right? For chemical exposure, for ammonia, for noise, things of that nature. And so this really, it's an infectious disease, so it may be a little new and a little bit different, but it's still the same process. Some of the questions to ask yourself, are you getting milk in from a region that H5N1 has been identified in? If so, you may raise your radar and raise your surveillance a little bit on the quality of milk coming in, for example. Working closely with producers to educate them about, if they see, one of the signs of this I should have mentioned too is seen in a vast majority of cattle is the milk is abnormal. It's clotted. It doesn't appear as normal milk, and so that should be the first thing farm workers should pick up. But there should be good communication between the farm and the processor to identify and exclude that milk from even getting to the processing plant. But we know there's going to be virus slip through, right? We've seen positive results in bulk tanks, and a concerning thing with this is we don't have a lot of data on it yet, but there have been positive. There have been farms where bulk tank samples have been banked, and once cattle have become ill, they've gone back and tested those bulk tank samples. And these are on very highly managed farms that are managing not only milk production, but feed intake, movement of cattle throughout the day with pedometers, things of that nature. And so in one case in particular, they identified virus in these banked milk samples up to 14 days before cattle showed any physiologic changes, let alone physical signs of illness. So, we do have concerns that milk from asymptomatic cattle that has virus in it is getting into the supply chain and it's getting into your processing plant. So that's why we want to take precautions around those lines. So again, this is just, we're trying to put this guidance for farm workers, especially because the high percentage of migrant workers, workers from other countries, workers who may speak on other languages and not be literate in those languages necessarily. So in addition to these printed resources, CDC is doing some social media outreach, some videos, things of that nature, trying to reach this population. So next slide. So these are some resources, particularly on the farm level, but this could apply to processing plants too, because wearing PPE generates heat stress, right? And so, there's some steps you can take to help mitigate that: work rest cycles, giving people breaks, providing, hydrating fluids, acclimatizing them to the work, letting them build up to the heat exposure slowly. And really some steps in addition to the PPE, I think that we probably should talk a little bit more about is education of workers. Educating them, knowledge helps dispel fear and helps put people's mind at ease to a degree. I mean, this is a serious situation, but knowledge on how to protect yourself helps. And if you become symptomatic, I think is really important. So educating your employees about the signs and symptoms of H5N1 infection, I think, is very important. As Dr. Reed said, primarily we've seen conjunctivitis on farm cases so far, some mild respiratory symptoms, but I think it's important that workers be educated that if they do have exposure and they do work with raw milk and they develop these symptoms, that they know to seek care, and seeking that care quickly is important because there are treatments that can be done. Years ago, you think back to the 1918 influenza, there was no treatment. And so symptomatic care was about all you could do. But we do have antiviral medications now that are more effective the sooner they're started after infection. So, we tell people if they feel like they may have symptoms to seek health care through their local provider or the local health department. And I think it's really important that they tell them what their occupation is. Yes, I work in a dairy processing plant. I handle raw milk, because providers don't often ask that. I've never been asked what my occupation was. I've asked who my insurance is through, but never what my occupation, what my job is when I go to a doctor. And that can be so critical, because this is not on the average busy, general practitioner's mind who's out there seeing, patients every 15 minutes. So that's an important part of worker education. And, as was said, raw milk is not a sterile product. We know that there are a variety of bacteria and other human pathogens in them. That's why the pasteurized milk ordinance came to light, 100 years ago this year, I believe, is to prevent illness in people, prevent all the tuberculosis cases that we're seeing, and brucellosis cases and things of that nature. And so we know that pasteurization works and is an important component of this. So, I was asked to touch on sanitation during this talk. So I talked with some colleagues at FDA last week, and you all probably know this better than I do, but really no changes have been made to the sanitation process recommendations as far as washing out bulk tanks, washing out tankers, things of that nature. Processes in place should take care of influenza viruses. One question I have for you guys, maybe we can get to on the question and answer, is what past procedures and current procedures are for disinfection of trucks, that are maybe going from farm to farm to pick up milk. That's something we've seen in the swine industry as being a risk factor of a trucker may take a load of swine to the processing plant, pick something up on their tire, their wheel wells, things of that nature, and spread it to the next farm. So that's something I'd be interested in learning more about. But as far as sanitation, many of the commercial disinfectants are effective. I believe if you'll go to the next slide, well, no, it's on this slide. Sorry, the EPA has a list of registered disinfection agents that can be used for influenza viruses. And of course, when you use these, you want to be sure and follow label directions. From a worker standpoint, follow this safety data sheets as far as what PPE may be needed for the disinfectant as well as the virus. So next slide, please. So a little more specific to your industry, I assume and I hope a lot of you have seen this guidance that was put out by the American Public Health Laboratories in conjunction with FDA, and CDC did have a review of that. And really it goes back to the hazard assessment. You know, what is your exposure to raw milk? You know, are you working in a lab plating milk samples versus, you know, you're working on the post-pasteurization side? You know, there really isn't a risk. But in general, we think we need to learn more about this and get more information. But obviously, we generally think the risk in processing plants is much lower than on farm, just because of the degree of exposure. You know, this was a concern early on amongst some folks at CDC that, you know, didn't understand the industry. And I'm not an expert in the industry by any means, but your goal is to sell milk, right? So you want to keep it in tanks, you want to keep it in pipes, you don't want it everywhere in the environment, because that's not good business practice. And so it really is a contained environment. And so, you know, in general, I think in a processing plant, what's been recommended is just good lab safety in general, treating samples as potentially infectious, not just with influenza, but other things. Trying not to touch your face, adjust your glasses all the time, good hand hygiene, glove wear where appropriate, proper decontamination of equipment, and proper disposal of raw milk that you may have to dispose of, following local and state guidelines, and just good work practices in general, I think. So I think with that, that's the main points I wanted to make, and happy to turn it over to you, Rebekah, and try and answer any questions we may have.
Well, I'll start with one, Dr. Gibbins, just so we say it out loud, because I think a lot of the folks online have already heard this, but in case you have not, the types of PPE that are recommended within a dairy processing plant, particularly for those who are working prior to pasteurization, pre-pasteurization employees, what is recommended?
You know, that's an area that
what we've been told, right, is goggles, right, to protect the eyes, or some form of eye protection to avoid splashing in the face, gloves, and also frequent hand washing to go along with that. Respiratory mask, which is of course one of the more challenging recommendations, right, because it's hot and it can get uncomfortable over time. That said, a lot of folks did it through the pandemic. We know it can be done. And so we've been emphasizing those things. Either Dr. Reed or Dr. Gibbins, do you see any of those recommendations changing anytime soon, or is that the standard operating procedure for the foreseeable future for dairy processing workers who are pre-pasteurization?
Well, I think our goal in some of the ongoing efforts that Dr. Reed mentioned on gathering more data is what's needed to hopefully back off some of those recommendations. And I want to stress that they are just recommendations, and it's, you know, this is John Gibbins talking, not CDC, but you know, you get into the worker protection aspect and then the public health protection aspect, you know, and those things can not be at odds, but you know, the concern of the mutation and all that drives some of the recommendations as far as higher levels of PPE. You know, I wouldn't discourage people from doing that, especially if they have concerns. You know, maybe they have health concerns of their own, maybe they have some underlying disease, you know, maybe they have PTSD from COVID, as we were talking about, lost family members from COVID. So I wouldn't discourage that level of PPE, but again, I think you have to balance the other risk factors. You know, wearing goggles, wearing a face shield, wearing a respirator or mask is not without hazard. If you're driving a forklift, it can impair visibility. It can cause safety concerns. So, I mean, that's where this risk assessment comes in. If you're a processing plant in a state that in Colorado, not to pick on Colorado, but if you're in a state or location that's had a lot of outbreaks, you may go to a little higher level of vigilance and PPE than in another state. And that's why I think it's really important to do a facility by facility look at this.
And quick, Dr. Reed, other thoughts on that?
Yeah, from biological standpoint, the reason why we recommend protecting eyes and protecting your mouth and nose is that's where the virus infects, right? And so we have receptors in our eyes that can be infected by flu viruses, in our noses, and in inhaling in our respiratory tract. And so I think, to John's point, really thinking about the hazard assessment, much of what we know historically about H5N1 is from poultry-related exposures. Much of that is from aerosolization of the virus and inhaling the virus, right? Which in some of these situations with dairy cows now, the primary exposure route has been milk contact, milk in the eye, milk on the hands that gets into the nose. And so generally speaking, the principles are things that protect you from getting any exposure to milk or aerosolized virus getting into your eye, or anything on your mucosal surfaces in your nose, or inhaling. And so kind of evaluating the hazards, evaluating the situation, which of those exposures do you really need to prevent in the situation that you're in? And what is the way that you could keep yourself from infecting that potential source is an important way to protect human infection.
Well, we'll be happy to talk with you more as you continue to work on that hazard assessment guidance for dairy producers and hopefully processors as well, so that we can give you more of a look at what's happening in our plants to help you create that tool. So with that, I want to make sure that we give just a summary of some resources before we get into Q&A. We have plenty of time for Q&A, so do enter those now in the chat. We've received several, and we want to thank you for those. Just want you to know that there are a number of resources that we're making available and that both federal and state partners are making available that are constantly updated. WCMA provides a host of dairy-specific information and fact sheets on our website, wischeesemakers.org. The CDC, FDA, and USDA have easy-to-read information online. Dr. Gibbins spoke a little bit about the importance of employee education, and there are great printable documents in many different languages available to you online. And for those of you that are in Wisconsin, the Department of Ag, Trade, and Consumer Protection is offering industry resources online. We partnered with them to create a 3-page poster or handout that is being used in a number of dairy processing plants already that's very specific to our industry. And DACAP also points to the Department of Health Services, which is offering an online form for you to apply for free PPE. So we know that a number of our members have taken advantage of that offer, and we encourage you to consider that as well if you need materials for your employees. And if you have other needs, please let WCMA know, and we're happy to be your go-between with our regulators and our partners in public health. We're going to learn perhaps some of those needs right now as we move into our live question and answer session. We did have a number of questions pre-submitted, which we are going to start with first. And I want to thank Drs. Reed and Gibbins for sticking around with us to field these questions. The first one we have, I think we've just kind of touched on, to be honest with you. Do all people handling raw milk need to wear PPE? Or is it just if you think the milk might be affected with H5N1? I think the short answer might be, again, to consider your hazards. Is that accurate?
Yeah, I believe that. I mean, there's the easy answer is to say yes, everyone should wear it, but that you have to balance that with the other hazards that may be in the workplace, and so that's where that risk assessment comes in. And so it's a risk benefit. There's no zero risk, right? And so especially with asymptomatic shedding, I mean, milk may be infected that's coming from a farm where cattle are not ill at all. And so I would say especially people are concerned about their own health. It's important for the PPE use, but not at the expense of creating another hazard if you're in an area with no known transmission, I would say.
It's a very even-handed approach, Dr. Gibbins. We appreciate that perspective very much. Our next question. Do you have any data that you can share on what portion of the dairy industry are following PPE recommendations from the CDC? And are you planning to monitor this? Perhaps that's a question for OSHA as well, but since you're here with us, Dr. Reed?
Yeah, I can take this. As I mentioned, some of the work that we are doing is to work with state and local jurisdictions to try and do more in-depth investigations in populations that are affected. And so we have updated on our spotlight. We did work with Michigan on a farm worker study in a few farms that were affected in dairy farms that were affected in Michigan, with the goal of more broadly offering enrollment to workers on the farm. It includes a survey about their use of PPE, the types of activities that they do on the farm, and then also collected a blood specimen to look for antibodies to see if people were infected and not recognized. If so, what type of job duties they have. Importantly, none of those workers showed any antibody response to H5, so no evidence that any of those workers were infected and unrecognized infections. But we did ask about PPE use, and in that population, less than half of the workers were using masks or gloves. Masks or eye protection. Glove use was much more common, but masks and eye protection were less than half. And so we don't have any systematic plans for widespread monitoring of that on our side, but we are, as we do more of these investigations, include questions about use of PPE just to get a sense of how often are people using this? Are there areas of improvement? Are there certain types of PPE that they're using more than others, and how that might influence some of the messaging and also some of the recommendations.
Thank you, Doctor. I know I don't have data, but anecdotally, I can tell you that many of our members are providing education and providing the forms of PPE to their employees, but ultimately not requiring that they wear them in the pre-pasteurization area. So that's what we're seeing, I think, most frequently. There are some that are requiring PPE, but most are offering the materials, offering the information, and letting the employees make a choice. Next question. What would make CDC or OSHA perhaps move toward regulation as opposed to recommendation when it comes to PPE for H5N1? I suppose that's kind of a crystal ball question. I don't know if that's fair to ask you. And it's fair to say you don't know. But do you have any sort of insight on that, perhaps based on our previous experience with COVID?
I can take it, Dr. Reed, if you want. As I mentioned, most aspects of CDC, we're not a regulatory agency, so we wouldn't have the authority to mandate PPE wear. And OSHA, there's not an infectious disease standard per se at the federal level. There is in California and maybe a couple of other states, but and we ran into that with COVID, right? What authority could OSHA use? And so there were some emergency, temporary standards put into place and things like that, especially for healthcare in areas like that ended up in the courts and ended up in some situations. So, my personal opinion, I think it would take a lot for that to happen. I mean, it would have to be, in my opinion, a similar situation to COVID, sustained human to human transmission. I mean, situation would have to change so much, I think. I think there are elements that would like to see this happen and would like to see regulation requiring it. I just don't think the reality is there, especially in the farm community. It has been very difficult. This is farmers' livelihood, right? They don't want to be identified as the farm that has an outbreak, and there's lots of financial incentive not to be that farm. We've seen in past poultry outbreaks, this has a huge mental health component, stress component to it also, in that it's been shown that poultry farmers who suffered outbreaks have been ostracized in communities because in poultry, they do a call of surrounding farms, right? Who may not even be infected, but in efforts to control it, they may call your neighbor's chickens that weren't infected. And so when you see them at church on Sunday, the conversation may not be great, or in the community. And these are small communities, everybody knows everybody. So there's that component of it that we struggle with. And in the dairy industry too. The dairy industry's been tough the past few years, right? I mean, it's been tough my whole lifetime, I think, as far as the price of milk, and goes in cycles, of course, but this is just another added stress. You know, if you've got a farm of 1,000 head of cattle and 20% are ill, somebody's got to treat those cattle, and there's not people standing around without work to do. And so just the added stress of that, plus the financial aspect, is huge. So again, there's unintended consequences that go along with mandating PPE wear.
Thank you, Dr. Gibbins. One final pre-submitted question, and then we'll get to the chat. The people who've gotten H5N1 in the US seem to have gotten conjunctivitis mostly. Does that mean that eye protection is more important than respirators? Are you more likely to contract it when the virus gets in your eye?
Yeah, you know, this is a questions that we're grappling with right now. Prior to this outbreak, we haven't seen much conjunctivitis associated with H5N1 specifically. There are other strains of avian flu, H7 variations of bird flu that have been heavily associated with conjunctivitis, but we haven't really seen it before for this virus. And so there's a lot of questions about what is different now. At first, there were thoughts, well, it's in milk. And so maybe there's contact between, you get infected milk on your hands while you're milking cows or cleaning, or you get a splash in the eye. And therefore, exposure to the eye is maybe more meaningful in this particular situation where we're dealing with exposures of dairy cows. So that was one hypothesis. And so certainly eye protection is important in this situation. You can also get conjunctivitis, though, even if you're infected through your respiratory tract. And so, you know, we have seen conjunctivitis associated with poultry-related outbreaks where there's virus that's kicked up in the environment, aerosolized, people are inhaling it. And even if they aren't directly infected through their eye, they still may get conjunctivitis. And so it certainly doesn't negate the need for respiratory protection, but there are a lot of questions that we still have about this particular virus and why we're seeing conjunctivitis now in ways that we haven't seen previously with H5N1.
So the short answer is no. Eye protection is not necessarily more important than respirators, and we don't necessarily know how people are contracting it, whether it's consumption or respiration or touching their eyes or whatever it is. We're still learning a lot about this, so stay tuned on that one.
Yeah.
Now I think we're going to go rapid fire into the chat here. A couple of great questions that have been asked. One is, and I think this is for you, Dr. Gibbins, because it's definitely a vet sort of thing. Can SCC be used as a preliminary indicator of infection? So somatic cell counts, can that tell us anything about H5N1?
You know, I don't really know. It's going back 32 years to my vet practice. My guess would be no, because that's a bacterial type of test, but it may also detect inflammation, where this virus may cause inflammation of the mammary tissue. So I'd be speculating if I try and answer this, but it's an interesting question. Sorry
to put you on the spot there, Doctor. Next question that we have, we can try to follow up on that for the person asking. Certainly we are seeing folks test their milk for H5N1, so we can follow up on appropriate test options. Or you can talk to your local veterinarian. I think that they are providing some advice to dairy processors as well. The next question that we have is, what is the infective dose of H5N1? Dr. Reed, maybe for you?
Yeah, I'll take that. You know, again, we're still learning a lot about this, but for human infection, at least, it's likely fairly high. The cases that we've seen throughout the world have all had very close, prolonged, unprotected contact with infected animals or animal products or bedding, litter, high exposure environments. And so this isn't a virus yet that is easy to infect humans. And so there's likely a fair amount of virus and a fair amount of contact needed for infection. But again, there are things we're seeing with this current outbreak that we haven't seen before with H5. And so a lot of questions that are still unanswered, but again, really limited to those with close contact with infected animals at this point.
All right, Dr. Reed, Dr. Gibbins, you've provided so much great information for all of us over the past hour. And I think I have to say, from my perspective, my opinion is a bit of reassurance as well, that the leadership at CDC is aware of some of the challenges that this presents within the dairy industry as well. And I hope you're understanding that we are here to partner with you. We're eager to have that sort of relationship as we move through this, learn more, and certainly should anything change. So we want to thank you so much for joining us today, and we look forward to continuing this relationship and this conversation as we move forward. Thanks for your important work. With that, I'll pass it back over to Grace for a few closing thoughts about what's ahead.
Thank you, Rebekah, and thank you again to Dr. Gibbins and Dr. Reed for joining us. And thank you to all of you for joining us, taking the time to listen in on today's webinar and ask those thoughtful questions. We appreciate it. We want to let you know before you go that we do have 2 more H5N1 offerings currently available for registration right now on our website. You can find this and all of the details needed for both of these events. Next Tuesday, we'll talk about H5N1 and food safety. And the following Tuesday after that, August 13th, we'll talk more about enhancing on-farm biosecurity practices. So don't miss either of those. If you have the time, it is well worth it. And as always, we're here to help anytime. So if you have additional questions or need more resources or assistance on H5N1, please feel free to check out our website or reach out to us anytime. Thank you so much and have a great afternoon.